monthly webinar series. As Allison mentioned, today we're talking about revenue cycle management best practices. I do want to give everybody a quick plug to check out our webpage for our monthly, our next webinar next month on revenue cycle, which is going to focus in on how healthy is your practice. Another great piece of data, if you have not seen that presentation yet, it's some really insightful information about practices and metrics and some examples. So make sure you check that out and sign up for that webinar if you have not seen that one yet. But today we're really talking about best practices for your revenue cycle. And when we talk about that, what are we talking about? Well, we're really, what we're going to talk about today is these 6 different areas with regards to best practices for revenue cycle, and specifically going into in-depthly looking at each of these areas and talking about what you should be doing, or what you if you haven't started planning for things like ICD-10, what you should be doing now, maybe changes that you can make in your best practices at the office to enhance these different areas. Lots of good content. Keep in mind that our folks at our company here are all very experienced. Our account executives have been practice managers, practice billing managers in the past, and we work with clients all the time on helping them to understand what their best practices should be inside their own organization. And it's a great piece of or set of data for us to then be able to share with you, on these free webinars for you to be able to take advantage also. So as we look at the different areas, first one is patient engagement. The world is changing, and we're going to talk about how the world is changing for the patients, and especially around how the market's changing, how the consumerism of patients and healthcare is occurring, appointment scheduling, understanding making sure the patients understand their responsibility. There's a lot changing in the patient engagement area, so we're going to spend a lot of time on that. Front office processing, things like eligibility verification, collecting payments at the time of service, things like that in that area. Provider enrollment and credentialing, that's another big area that a lot of folks kind of forget about. We'll talk about that. And then really around technology and making sure you have the right technology and the right processes and the right tools to help you be successful. So let's jump into this, and we're going to talk about each of these different areas. Let's talk about the historical revenue cycle approach, and it was very basic. You had your, and this is really based in the practice management systems that are out there. It was based in an appointment scheduling module, and then that appointment scheduling module then flipped over and moved, and the information then fed into the charge capture or encounter creation area, where typically prior to EMRs, the adoption of EMRs, paperwork was sent over to the billing folks, and they entered it in manually into the system. The claims were sent out to the payers, and follow-up was done, denial management was done, and eventually the patient paid on the back end of the process. So it was a very easy, streamlined approach. Unfortunately, that easy, streamlined approach is changing. So as we get into the new world in 2014 and beyond, things have changed. And I think not more than just going from 4 bubbles to 5 bubbles. Inside the process, it's changed a lot. We now have to deal with patient engagement. There is a large amount of competition out there in the physician world. Patients are now starting to look differently at doctors and trying to decide which doctor are they going to go see, especially when doctors are busy and unfortunately when they call and they have to, they're trying to schedule an appointment and it's 2 to 3 months out. There has to be something else that's going to make them want to wait for that appointment, as opposed to finding a different doctor to go see. So lots of change in the patient engagement in the front end of the process. It's more than just scheduling. Physician charge capture. This has changed with EMRs. The world, the life is a lot different in the charge capture world. It's a lot easier in some ways because of the electronic nature of it, but it adds complexity and issues into that process that practices have to adapt to. Denial mitigation. Again, this is where we're trying to avoid denials on the front end. We're no longer just waiting for the denials to come back on the back end and get them and then fix them. We're working on trying to eliminate the denials on the front end, and that's one of the key components to revenue cycle is making sure that you're only you're dropping down your denials by 90 to 95% and not having that delayed payment process. Billing follow-up pretty much is the same, although in the new revenue cycle world, there's vendors out there like MDeverywhere that assist practices with that and can help you to be better at the follow-up and to partner with you on the follow-up. And then the last part is denial analysis, and this is really understanding what you did wrong and not just saying, oh, well, hopefully we'll do it right next time, but building back into the processes fixes to not allow these things to happen again. So the world has changed, and it's going to continue to change, as we all know, going forward in 2015 and beyond. Let me talk quickly about the patient consumerism, and I said the word better that time. So, again, the consumerism of healthcare is on the rise. And what does this mean? What are we talking about? Well, the reality is we're talking about the changing in the models, the changing of how healthcare is being delivered. And the first one that's hitting a lot of practices right now in many different areas is these high deductible health plans. Organizations are moving to the high deductible plans or the HSA plans, lots of different options out there that are all falling into this bucket. Obviously, what does that mean? Those high deductible plans are meaning that more of the responsibility is being pushed to the patient. And so therefore we have to react to that. We have to change our model, change how we do things to make sure that we're adapting to these high deductible plans. Cost sharing models, and then also the healthcare insurance exchanges. All these are changes in the marketplace that we have to adapt to, and we have to be ready to or build our processes around how to optimize these. Whether or not and obviously this is all based in PPACA and everything that's being rolled out with PPACA. The legislation, private companies and payers are promoting these cost of care transparency, many things in this space. And as I mentioned, the HSA plans, the consumer-driven health plans, they require the patients to not only take on more of the burden, but it's also requiring these patients, again, to be consumers of the process and be consumers of their own health needs. And they, again, in that, they have the skin in the game that's going to force them to go down this path and be more involved. And then lastly, here you'll focus on interactive tools to engage your patients. As a part of that process is giving patients what they want. Not just assuming that that the doctor's office is a specialist that they need, and so therefore, and you're closest to their house, and therefore they're going to go to your location, or that you're tied to their primary care physician, so therefore they're going to come to you. There's a lot of opportunity for patients now to use interactive tools on their side to be able to find the best doc for them. And you, as a practice, need to be prepared for that and make sure that you're competing for that patient's business. So one of the choices there is online appointment scheduling. And this is, again, here's a perfect example of a new world. No longer are patients wanting to pick up a phone and call an office and wait on hold and then be able to get through and schedule an appointment. They want an ease of access. They want the ability they want that convenience, the ability to look at, be able to do set appointments on their own and not have to worry about when the office is open. And this is that consumerism that is occurring in the market. So things like online patient scheduling, it gives them 24/7 access. If it's 11 o'clock at night and they go, oh, I forgot to call, they don't have to wait till the next morning and hopefully remember the next day. They can go online and schedule that appointment online. It also reduces resource time and cost for you. That's a big change. You don't have to have, hopefully you're not taking as many calls from patients as you have in the past. You can also easily capture key communication information. So again, you can capture a lot of information where someone's filling out the form online in a secure mode where you can capture that and have that information. That's much harder to capture on the phone where you're asking questions and trying to type it into the system. And again, it really allows also for the patient and the consumer to own the process. You don't have to worry about owning that process, and it does drive the patients to your website, which allows you to market. It allows you to market out to them, give them information, utilize your website as a knowledge base for your patients, which then all that does is build you as that trusted advisor, that trusted location that they know that they can come get information about. So. The online appointment scheduling and use of your website are two key areas of kind of the new world of where we're going with this consumerism of healthcare. And the second part, obviously, is once you get them scheduled, keeping them. We don't. Typically, what we hear from MGMA is most practices have anywhere between 5 and 7% no-shows. That's just way too high for a practice. That's too many appointments in a day. If you think about it, I say a typical 2-doc office that might see somewhere in the range of 60 patients, 60 patients a day between the 2 docs. You're talking 3 to 4 to 5 no-show appointments. That's lost time, that's lost opportunity, and given the reality that for many practices, when new patients are coming in, they're having to schedule appointments out in 2 to 3 months out to be able to get them scheduled. Every one of those no-shows is a missed opportunity for a new patient. So, really building, utilizing interactive tools for the patients on the reminder side. So once you get them on there, it's no longer a world of just phone calls. It's no longer a world of just automated phone calls to remind them of their appointments. It's texting, it's emailing, it's giving them giving an opportunity for you to be able to interact with them in a lot of different ways beyond the standard phone call process. And it really allowing them to have links to update their personal calendars. So this is new, in a lot of ways. Businesses have been doing this for years, but having the ability for them, since most likely they're on their smartphone calling your office, allowing them, when they make that appointment for a appointment reminder to come down and they click on it and it updates their calendar on their smartphone. So now, you're giving them the information that they need. They're living in their world to allow them to remember they have these appointments coming up. Getting messages different ways. Texting is the key one, I think, in this space because people are on their phone, as we've all seen. And we thought, just to give you a feel, we added internal messaging into our system nowadays. So if one of our clients has a question for their support team, they actually can text a message through the system to our support team and get answers back within 3 to 4 minutes. We thought it was a simple little thing, but we added it in there, and our clients love it because that's what everybody's mindset is now. It's in the texting world, and again, trying to take advantage of the technology that's there to help you in this space, such as texting, is key. Looks like we're here. So the next part of this whole process, and again, this is all part of the patient engagement section, is helping the patient to understand their responsibility. And where this comes in is obviously, and again, this is very tied into the fact that more and more of the responsibility for a claim, for the payment of a claim, is going to the patients. Can you believe that right now it's nearly 25% on average that the value of a total claim, a bill or claim, is in the hands of the patient? That's almost mind-blowing when you think about it. And again, we need to make sure that you need to make sure that the patients are aware not only of what to expect, but also to be aware of what their responsibility is. And so we need to create tools to allow patients to not only estimate the cost of their services, but also come up with a way to communicate to the patients their payment obligations. Make sure that they fully understand and know that what their obligation is, even before the appointment occurs. So lots of communication needs to be done ahead of time with those patients and at the office there, just so you're setting expectations with them as far as what their responsibility is. And really, why is this important? Well, I can remember back in my DME days, patient responsibility was a nice to have. We were getting paid enough for our back braces and knee braces and our service and our customization that, if we got the patient portion of it, at that $167, as I used to say with our back braces, it was gravy. It was wonderful. Well, that's not the case anymore. As everybody knows, that now that patient responsibility, or that patient piece of it, is in a lot of cases the profit. That's where you're making your money, is by getting that patient patient piece. And so therefore, it's very important that we do everything we can up front to get that patient knowledgeable of what their responsibility is to pay, and then again communicate with them the terms and the timing of the payment expectations. This is extremely important as we go forward. As the patients get their statements, they need to know what the expectation is based off of your practice, just like they know for their credit cards, just like they know for their electric bill. they know that they have, X number of days, that they should pay after they get their statement before they're going to start getting penalties. Well, we're not at the point of necessarily, hitting with penalties yet, but that we need to give them that, in the healthcare world, that same level of understanding and timing in terms of, that they're used to in the other spaces, so they can react to it just like they react to it in the other spaces. And then really, again, have the tools to help verify the insurance. And this is important too for these high deductible plans. And we'll talk a little bit more about that in a sec. But it's very important that we truly understand, what that patient's responsibility is up front. Make sure they know that they have a $600 deductible plan that they haven't met any of yet. And then work with them to try to collect some of that on the front end. If your state allows you to do that, collect some of that on the front end, so that way you're limiting the amount of patient pay that they're going to have on the back end. The old statement, patient-friendly statements. This has been out there for years. I think everybody, if you've been in healthcare for a while, you've been hearing this term for eons, and how there was going to be all these standards out there that they were going to implement, and CMS was going to drive this forward, and of course it never really happened. It never really occurred the way we all expected it to. So unfortunately, we have to do that. And I say we, being we as a vendor and you as a practice, we have to try to do this the best we can. And it's really making the statements not only easy to understand, but also easy to read and easy to look at. There's studies out there that shows that patients will react much more favorably in the form of making payments faster if they are looking at a statement that they feel like they understand and they know what it's telling them. So it's important to use be clear and bold. Brand your logo on your statement. Make sure they know it's from you. Clear contact information, where to call if they have a question, what the remittance address is. They need to know it's you, so there's no confusion out there. There's a lot of statements that come out of systems where you look at it and it's hard to tell who it's coming from. The only way you can tell is by looking at the return address, and that's just not the best way to do it for patients. Use legible fonts. We've got a growing older population, as we all know. Many of you have elderly population, strong elderly population. You need to make it as easy to read as possible for the elderly folks, or folks like me who aren't elderly, but I can't see anymore, so I have to have my glasses to read. We have to make it as easy as possible. They need to be concise and correct. And correct's the important piece, but concise is just as important too. Really, we need to limit what they see to just what they need to know, not necessarily give them all the nitty-gritty details that are going to cause confusion. It needs to be very concise. It needs to be very easy for them to understand that they had this appointment, this is what was owed, this is what was paid by insurance, and this is what their balance is. So it's very clear to them, that this, it's been fully adjudicated and now it's in their hands. And then the last part is with statements is making sure that we have multiple different ways to send it. The U.S. Postal Service is a great organization, but it's not the only way, and it's not necessarily the most efficient way, and it certainly isn't not necessarily the way that you're going to get the most payments back. So having things like online statements, email statement notices, things like that, where you're taking advantage of the technology and taking advantage of the shift in consumerism for these patients, because most of them are getting their, I know personally, I get my cell phone bill for my children via email now. Or a link to it via email. I look at our gas and electric bill online. I don't get a paper statement anymore. And the thing is, when I click into that, I click right on the button to go pay. So building that process, that you're using those multiple delivery options and taking advantage of the technology is key for patient-friendly statements also. And that goes right into, let's just talk about the online bill payments. So, again, in the real world out there, the non-healthcare world, everybody's doing it. People are, I think I heard a study that the number of people who are making payments on or paying all their bills online from 10 years ago to today has I think quintupled in the numbers. People are moving towards electronic processes. People are sitting there on a Sunday or on a Monday or whenever they do their bills, and they have all their bills, and they're sitting at their computer and they're going in their bank and they're processing payments. And we need to make sure that we take advantage of that in healthcare. And one way certainly is giving them the ability to to obviously use their banks to make a payment, but that still means the mail. That still means USPS is going to mail that to you, and you're going to receive that check. We need to give them options, online bill payment options that can make it faster and easier than that check and stamp method. It eliminates payment procrastination. It's a lot harder for folks to write a check out, put it in an envelope, get stamped, get it to the post office and mail it out. If they have the ability on their statement to see a web address that says go here and make your payment online, and it's clear that this is you guys, your website is very clear, there's no confusion, and they can make a payment, your people are going to make payments more quickly. And I know that a lot of folks say, well, it's the elderly population, they're not online. I say this all the time. I use this as an example. My 75-year-old mother-in-law, she buys books and stuff online. She would never have done that 10 years ago, not even 5 years ago. The elderly population is moving this direction too. I know we did a study at one of my past jobs where we were looking at the average age for people who make online payments for healthcare, and at that point for that company, their average age was 52. So that means that 52 is the average. That means and we know that there's a lot of younger kids that do it, and so that means there are older patients who also do it there too. So take advantage and allows them to not procrastinate. It verifies the ability of the funds at processing. You're taking away the option for bad checks coming through the mail that you can't that you go to deposit, and now you're trying to go back out and collect it. It eliminates processing on your side. You don't have to build those deposit slips and get those checks to the bank to process them. It saves you some time on that side too. And it's easy to access to the patient data for tax purposes. You have all that information right online there. It's all recorded into the systems as opposed to being a manual process. And obviously, the key thing there is, as all lines back to, eliminating late fees, eliminating overdrafts. You're making the process more streamlined. And again, you're getting your money faster. And that's the key thing. It's not only getting the money, but it's getting the money faster and being successful on that side. Those, which is eliminating no-shows, because obviously no-show appointments is opportunities will allows you to have more open time slots, so therefore you can bring in new patients before they may have been extended out and not be able to bring them in a quick manner. But there's also instituting a recall and preventive marketing strategy. So, recalls are, the recall process is one where a lot of practices unfortunately fall down a little bit on not on reminding the patient or telling the patient, or not reminding the patient, but telling the patient that their doctor wants to see you in 6 months or 3 months or whatever the timing is, but making sure that patient comes and actually attends that appointment when it occurs, and doesn't forget about it, or doesn't somehow go to some other doc, or and you miss that opportunity. So a recall strategy and having the ability to automate that process, not having it be a manual process that someone has to track and look and watch and make a phone call or send a letter out, making sure you have a true process that allows you to automate that recall notification is key. And then and then the preventive marketing strategy, it's making sure that you're optimizing those preventative measures, getting those patients to continue to come back for their preventative treatments that they have for whatever their illness is, whether it's as you can see on the screen here, whether it's diabetes or whether it's any type of breathing issues that they may have. Making sure that you have a strategy there for this chronic disease management to help them to make sure that, or to not help them, but ensure that they're going to come back to you guys and they're going to stay with their with coming back in for their treatments or whatever it is that they need to come in for. And instituting this preventative marketing strategy, it's really a vital lifeline in maintaining that practice's revenue optimization and enhancing the care management for your consumers. Again, you're giving them a service. You're helping them to remember the things that they should be remembering on their own to do, but they may not. And then other things like health assessments, offering out to them the ability to do health assessments. Obviously, this may not be applicable to every practice, but giving them, again, it's another way for them to need to come in and want to come into the practice and come in and schedule another appointment. So again, growing your volume is key going forward, and it's a mindset that everybody's got to grab onto, and it's hard because we haven't been in that mindset in the past. So eligibility verification. So this one again is another big area, and actually as we look at claim denials that occur, and the MGMA has said this in the past, that more than 25% of payer denials occur because patients are not eligible for the benefits. And that's an awful big number. Unfortunately, it's probably, that one may even be underestimated a little bit. But making sure that you have a strong eligibility verification solution to be able to implement that's proactive and not reactive is key. And when I say proactive versus reactive, an eligibility strategy cannot be the patient shows up, I get their card at the window, and then they go back and see the doc, and sometime later that day or the next day I call the payer, or I go on to online to my clearinghouse and I check their eligibility. That's the wrong time to find out. Even at the time when they're at the window is the wrong time to find out, because now if you find out that the only insurance they have with them is this one card and it's not valid, it doesn't give you the ability to have a choice. Your patient's there, they're ready to see the doc, and we all know that's what we want to do. We want to take care of patients, so it's very hard at that point to tell the patient, I'm so sorry, we're not going to be able to see you because you don't have insurance. Or if they say, oh, I got the new card, it's at my house, and now you're counting on the fact that they're telling you the truth. So having an eligibility strategy is key. Having an automated process, whether it's through your system or through a clearinghouse, having some way to automate the process so you don't have to remember to do it. Taking the responsibility out of the hands of the staff and automating the process. And not only automating it, but doing it in advance, making sure it's part of your scheduling process well in advance of the appointment. It's better to learn that a patient doesn't have insurance when they place their appointment than it is to learn about it the day of. So having a process where you're checking eligibility up front at the time of insurance, entire time of the appointment scheduling, and then being able to make sure you react to it and track that, and don't allow yourself to be put in that hard spot of having to make that decision at the time when the patient's at the window. And this is where that online registration can be very beneficial too. If you have online registration for appointments, then at that point they can enter in their insurance information, and now the next morning, if someone does it at night, you can see on the schedule that that person doesn't have correct insurance, and you can reach out and get that corrected beforehand, before they're at the window. Oh, Sarah, I'm sorry. Let's go ahead and talk about streamlining your charge capture process. So, honestly, this is the new world for a lot of us. A lot of folks are going down this path, with regards to the charge capture process. And the key thing here is again, this is really the opportunity to be able to not only speed up your process but limit your costs. Having some way, to be able to capture those charges from the physicians on the Super Bowl bill, either with an EMR or EHR or some sort of charge capture process, will allow you to not only decrease the lags in the charge submission, but also, again, put a lot less work for the staff and having to rekey information back in. So, this is part of, this is going away, more looking at the process, obviously the revenue cycle processes. But the key to the beginning of the revenue cycle is making sure that charge capture occurs correctly and quickly, because that's how we get the claims out the door faster. That's how we can get paid faster, which is really optimizing that revenue cycle. And then, again, making sure that whatever you have allows for point of service edits and consistently provide communications to the billing group. Again, this is where making sure that you not only capture the charges, but really take advantage of the ability to understand whether the charges are coming through correctly, and then educating the staff on what they're doing and what to look for. So, key thing here, we're all very in tune with EMRs and EHRs, but you got to go and implement these things, because they're definitely, offices definitely need to do that. And just because you may not be, having to deal with meaningful use doesn't mean that you don't want to take advantage of the technology. It just makes the office run a lot smoother. The next one is creating an effective front-end collection process. And again, this is where I mentioned this a little bit earlier. We're talking about this change, the shift in the market as far as patient responsibility and the fact that it's growing, and we have to adapt our front-end processes to react to it and to make sure that we're not missing opportunities. And this ties back into the eligibility piece. If you run the eligibility ahead of time, and your front office staff, when the patient comes in for their appointment, knows what that situation is, and it goes beyond what their copay is, but understands what their deductible responsibility is and where they are. And again, the importance of having that detailed eligibility information on the front end to understand what exactly the patient's responsibility is going to be ahead of time. And then again, based in your state, if your state allows for you to do it, building a process to allow them to pay part of that. So if it's a $600 deductible and you know that your services for that patient and for this appointment are going to be $500, you know that full $500 is going to be patient responsibility. So let's work with the patient up front to say, we'd like to collect part of this up front so we're not having to hit you with the whole amount later on. And that just helps you in limiting the amount of balance that you're collecting on the back end. And then utilizing automated payment plans, and this is something that is not, is available in some systems out there, but even ones that offer online bill pay, they don't offer this automated payment plan process. You can easily, when the patient's there, either look at their deductibles or, more importantly, look at their account that you guys have and see that patient's coming in and they owe you $200 from your last appointment, and see if you can get that payment then. But if they can't pay it, set them up on a payment plan. Set them up on an automated payment plan that you can collect that money from them, and not necessarily, not just assume that they're going to pay their bill on the back end. Give them options. Again, patients are consumers in this world. They like options. They like the ability to pay, and I truly believe that most patients that if they appreciate the services you're giving them, they want to pay their money. They want to pay for the services that you're giving them if they're experiencing good service. So we just got to give them a way to be able to do that. PQRX. So this is obviously very much tied into the folks to certain populations of folks. But it definitely is one where it's not a change. Obviously, PQRX has been around for years, but it's still amazing how many people are not taking advantage of it and trying to get this extra reimbursement on the Medicare side of the house. So I think everybody understands what PQRS is. If you don't, there's lots of things out on the web. I'm not going to go too in depth into it, other than to say that it's really a reporting program that uses a combination of incentive payments and payment adjustments to promote reporting of quality information by eligible physicians or professionals. So again, and so basically it's picking the key things where you can get some additional reimbursement back if you do what you do well. The key thing here is you don't necessarily sit back and hope you're going to do this, hit these quality measures on your own. There are lots of tools out there, lots of applications, lots of systems. And MDeverywhere is one of those that can help you with this process and building in the rules and checkers and such to help you to make sure you qualify for your quality measures by hitting the levels that you need to. Really keep in mind, 2014 was the last year to receive bonuses. Going forward, the flip is happening. 2015 will have payment adjustments for non-compliance. So again, they tried to enhance and set people to do this ahead of time, by giving them bonuses. But the world, again, is another change in the world. With all of everything we have to deal with, there's going to be a payment adjustments if you're not successful at this. And again, it lists out the 9 measures from NQS across 3 domains and what needs to happen. So if you've never looked at this, it's time to look at it now. But if hopefully you've had some time and you've done some work on this side. So denial mitigation. Again, this is that upfront process, and we talked a little bit about it. It's the upfront scrubbers, making sure that we are cleaning the claims up as much as possible, and not just doing the clearinghouse checkers. You need to look for solutions that will help you to identify payer denials that are occurring on the back end, that are occurring on the front end, but catching them on the front end before they go out. Because every time a claim gets denied, your payment time increases by 45 to 60 days on average. So, so you need to make sure that you build solutions that happen on the front end that help you to mitigate these denials ahead of time and not allow them to get to the payers. And again, this will just help with regards to your overall cash flow. And in addition, some examples just so, for denial prevention edits that we see, services requiring pre-authorizations or referrals, insurance verification failures, LCD exclusions, diagnosis and CPT inconsistencies, appropriate modifier utilizations. All these are different ones that we see on an ongoing basis that there needs to be a way on the, you need to have a way on the front end to capture these before they go to the payers. These are some of the most frequently seen errors that come back on the denial side. Oop, Allison, we got another poll. I think this was our last one. Or we got a credentialing and enrollment. Again, this is important. It's the overlooked one, the one that gets, that tends to be lost in the shuffle, is just making sure that you're tracking and effectively watching your provider's credentialing, because you don't want to be in a situation where your Medicaid lapses and now you're having to go back and rebill stuff a second time. It's a lot of wasted time, a lot of wasted efforts. If you have a smaller practice, it's a little easier, but if you have a larger practice with 10 or 12 or more docs, there's partners out there that can help you track this. It's a lot easier for them to do it than you. So keep in mind that you do whatever you can on the providers, on the credentialing side of the house to keep it up to date. The technology-driven claims processing. So again, what we're talking about here is being able to automate the claim status verification process, making sure that again, that claims aren't getting lost in the shuffle. They're not getting lost in the process. And when a payer denies the claim due to a defect, having a denial management and a denial, going beyond denial management to denial analysis, and not only fixing the claims, but also improving the process to avoid that claim in the future. And reviewing your denials on occurrence and developing an edit that prevents that in the future. That's part of that question too. The last poll question is, do you have that engine that checks your claims? Well, it's not only having the engine, but that engine needs to live. It needs to be continually updated with new denials that come through, and not all just keeping it as a static solution. So make sure if you're using a vendor who has that, make sure they're adding things to there, and not just adding your denials, but you should be able to take advantage of all their clients, the denials that all their clients run into. So, and then the last one is, again, adopt appeal and prevent mentality. That's going back again to the whole process of appealing it, fixing it, but also preventing it in the future. The next one is enforcing payer compliance. This one is another one like credentialing that gets lost in the shuffle. This is making sure that your claim, that you're not being underpaid on your claims. And again, I think most organizations, what they do is they look for those outliers, those big dollar ones, the $25, $50, $75, $100 and more ones that are obvious. What gets lost in the shovel is that $5, $3, $10 ones that people just don't have time to follow up on. So this is a big area. There's lots of different numbers out there that are said. Some folks, we usually typically see increases in collections for our clients of about 2 to 4% purely by us following through on all those small underpayments. So you have to have a system that not only flags it and identifies those underpayments, but gives you the, if you need it, find a vendor who can help you on the back end to go and get those underpayments paid. Because this is a big area of lost revenue. People leaving money on the table is a big area in this space. Allison, before we jump to the conclusion, is we're really going to talk, look at ICD-10. And I know everybody's going, no, not ICD-10. We're tired of hearing about ICD-10. It's been delayed. Well, don't take that mentality. You need to be doing stuff today. Don't wait. I've done ICD-10 webinar presentations before. This isn't a chance to say, I'm going to wait till next April and worry about it next April. This is, or take the odd wording that says, ooh, we may implement it in 2015, but we may not, and think, well, they're going to delay it again. You can't do it. You have to. This is a lot of work, a lot of effort. You need to be prepared when the time comes. And unfortunately, there's going to be a lot of practices out there that aren't going to be prepared. Now, luckily, the delay is helping some of the software vendors out there and the payers that weren't going to be ready for it. But again, there's still a lot of effort that needs to happen at a practice level, and you need to make sure that you're working effectively through this and don't let yourself get behind and not be prepared on it. So let's talk about the key takeaways for you, from the presentation, and hopefully you found the information helpful. Again, embrace the patient engagement model and the role that the role they have as a consumer in the healthcare market. Again, these patients they're different patients. They're not our old standard patients that always go to the same doc. They're looking for the right place to go, and they're looking for the right physician to work with, and that's key. So make sure that you are not that you're engaging or you're embracing this process. Surround your front office with tools, technologies, anything you can to streamline the patient experience and reduce claim and defects. Let's eliminate denials. That's the goal, is eliminate denials and make the patient experience as positive as possible. Use preventative treatment plans as a way to grow. Go out there and build that volume in your practice. It's key. It's how you're going to survive in the future. And unfortunately, this is becoming a volume game. It's no longer I always just a quality game. It's a volume game also. Manage your provider enrollment process. Make sure you're monitoring your payers processing for both denials and underpayments, or getting someone to help you do that. It's important that you track all that. And again, as I reemphasize, do not sit back and wait for ICD-10 to come and be surprised. You need to do the effort and the work ahead of time to be prepared. And real quick, just to kind of close with a little bit about MDeverywhere. Like Allison mentioned up front, we're a leader in the revenue cycle management space. We have a full, complete revenue cycle solution from EMR all the way through patient portals. It's all included in the system. If you have your own EMR and you don't want to use ours, we'll interface to your EMR. If the doctor's using it, you don't necessarily want to change them. So we can interface to that. We're real flexible. The solution has all these tools that we're talking about here. They're all in the system. It's all there for you to take advantage of. So one-stop shopping for everything you need. And we're not new. We've been around, since 1995. We've serviced over 7,000 physicians across 40-plus specialties. We see 10 to 15% increases in collections with our patients. With our clients. So you will get extra money. You're going to have to pay for it. It's not a free service, so keep that in mind. But you're going to get extra money and that extra money is going to outweigh what you're paying us to make it happen. We're going to decrease your denials by that 95%. And again, as Allison mentioned, we're an NCQA certified CDO. We have experienced people, and we're really the only vendor that's been doing the whole solution for years. Many vendors are maybe getting a little bit into the certification side and the credentialing side, but they have they're not experienced in it. They're not knowledgeable in it at all. And it's definitely something where we need to make sure that we're that we're offering out that total solution for you. And as I mentioned, don't hesitate to go to our webpage. We have webinars, as many of you know, because you get our emails. We have at least one, most of the time 2 webinars a month. All of them are industry topics, topics like this. Other than this one slide, they're not commercials. We're not going to sell you on coming with us. But it's a lot of great knowledge base out there, and a lot of great information for you. So again, I want to thank everyone for attending. We're hitting right towards the end of our hour here. Hopefully, we got some questions. If you sent questions in, we'll respond back to you via email and give you the answers to the questions you had. And again, I appreciate everyone's participation, especially in the polls today. And I hope you have a wonderful rest of the day and a wonderful weekend. And this will end our webinar. So enjoy the rest of your day. And again, thank you so much.